That means he'll be on time. Run up. I'm sure he'll be out there right at 5 o'clock.
And you'll be standing next to...
Okay, yes. More than 12,000 fans are expected. How's that? All right. All right. Yeah, and I'll
You'll be standing next to Betsy. The
okay.
chair that's empty right now.
When we don't know how long.
And listen, I'm not advocating for shutdowns, but I'm just saying, last year, cases weren't as high as they are today, and fans weren't filling stadiums at 100,000.
I do. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Yeah, I got that today from.
And now, live from WKYC Studios, this is What's New.
Hello again, Northeast Ohio, and welcome to What's New for Thursday, September 9th, alongside Betsy Kling. I am Jay Crawford. Thanks so much for spending time with us on this beautiful afternoon. We want to start by telling you we're awaiting President Biden's speech. It is expected any moment now. He's going to be announcing some sweeping new federal vaccine requirements as part of his new plan to control the Delta variant. It's going to shock some people what he's going to say.
There's a lot of breaking news that's been happening this afternoon, not only regarding the COVID announcements, but throughout the government. There's been a lot of big news that's been happening today. But as Jay said, we are standing by. The president is expected to come to the podium at any moment. And when he does, we will get to it as soon as it begins.
In the meantime, while we wait for that, our senior health correspondent, Monica Robbins, joins us now with what the president is expected to announce. Monica, good afternoon to you. I think some of what he's going to say might surprise some folks.
Yeah, I think it's going to surprise a lot of people. This is, he's pretty much throwing down the gauntlet at this point. And for the unvaccinated, this is definitely targeted toward them. So as you mentioned, he's expected to announce new vaccine mandates. Those include signing an executive order requiring federal employees and contractors to get vaccinated. NBC is also reporting that the president will ask the Labor Department to create a rule that requires employers with more than 100 employees to mandate mandate vaccines or regular testing. He's also expected to call on schools to set up regular testing. And the federal government set aside $10 billion in funding for COVID screening tests for teachers, staff, and students, but it's unclear how that money will be spent. And right now, just over 53% of Americans are fully vaccinated. In Ohio, 48% of residents are fully vaccinated. But don't be surprised if he's also going to ask for mandates from healthcare facilities as well, especially those that receive Medicare and Medicaid reimbursement. So a lot coming out as soon as the president takes to the podium.
All right, and again, as soon as he does, we will take that live, certainly. But we want to take a look at today's COVID count here in the state of Ohio. In the last 24 hours, 7,897 cases have been reported. This is our highest daily number in the last 3 weeks. Keep in mind, the last time we had nearly 8,000 daily cases was back in January. Our 21-day average case count is now above 5,000.
Yeah, Betsy, the drumbeat goes on for hospitalizations as well. A big number, however, that number took a huge dive from yesterday. That's primarily because hospitalizations were backlogged from the holiday weekend. But the state reporting today there were 255 new patients in Ohio hospitals. That's about 200 fewer patients than we saw yesterday. In all, though, there are now 3,178 COVID patients in Ohio hospitals. They are taking up almost 12% of the state's hospital beds.
Now on your feet at 5. Well, the president is going to be taking the podium. That's the latest thing on your feet at 5. We now go live to Washington, D.C. and the White House where the president is
speaking.
speaking.
Progress we've made and the work we have left to do. And it starts with understanding this. Even as the Delta variant COVID-19 has been hitting this country hard, we have the tools to combat the virus if we can come together as a country and use those tools. If we raise our vaccination rate, protect ourselves and others with masking, expanded testing, and identify people who are infected, we can and we will turn the tide on COVID-19. It'll take a lot of hard work. It's going to take some time. Many of us are frustrated with the nearly 80 million Americans who are still not vaccinated, even though the vaccine is safe, effective, and free. You might be confused about what is true and what is false about COVID-19. So before I outline the new steps to fight COVID-19 that I'm going to be announcing tonight, let me give you some clear information about where we stand. First, we've made considerable progress in battling COVID-19. When I became president, about 2 million Americans were fully vaccinated. Today, over 175 million Americans have that protection. Before I took office, we hadn't ordered enough vaccine for every American. Just weeks in office, we did. The week before I took office on January 20th of this year, over 25,000 Americans died that week from COVID-19. Last week, that grim weekly toll was down 70%. And in 3 months before I took office, our economy was faltering, creating just 50,000 jobs a month. We're now averaging 700,000 new jobs a month in the past 3 months. This progress is real. But while America is much in better shape than it was 7 months ago when I took office, I need to tell you a second fact. We're in the tough stretch, and it could last for a while. Highly contagious Delta variant that I began to warn America about back in July spread late summer like it did in other countries before us. While the vaccines provide strong protection for the vaccinated, we read about and hear about and we see the stories of hospitalized people on their deathbeds among the unvaccinated over the past few weeks. This is a pandemic of the unvaccinated. And it's caused by the fact that despite America having unprecedented and successful vaccination program, despite the fact that for almost 5 months, free vaccines have been available in 80,000